I've been asking you for the last few weeks to talk to me and tell me all about your experience of lockdown, because I think we focus so much, and I understand why we do, on people losing their lives, on the people who are mourning their family members from COVID. And we focus on, as we've seen the broadcast media repeatedly, the nurses and the doctors doing amazing work working in those ICU wards, dealing with COVID patients, trying to keep them alive. I'm in no way undermining those traumas and those difficulties. However, there are also 6-7 million other people who are living with the consequences of lockdown, despite the fact that the vast majority of those people are at very low risk of hospitalisation or dying of COVID. Those are the simple stats. 88% of deaths, very sadly, are from people over the age of 70. We've seen children stuck at home, people's businesses closed, people's lives tiny fragments of their lives left, not allowed to see family, to socialise, go to the pub, go to work often, and certainly their children not able to go to school. So I've been asking you to tell us your stories. If you want to tell your story, do get in touch. You can email to breakfast@talkradio.co.uk. That's breakfast@talkradio.co.uk. Well, one such person who wants to tell their story is Dr. Amanda Bailey-Hass, who's a physicist living in Yorkshire. Amanda, good morning to you.
Good morning,
Good
Julia.
morning. Now, you are married. You've got a little girl who's almost 4. You're 29 years old. How has lockdown affected you?
Well, it's been very hard. So I don't know whether you said, but I'm not English. So I came here in 2011 with 2 suitcases and £500 to study to become a physicist.
From where?
From Denmark.
From Denmark, yeah.
Yeah.
Better English than most of us here. Well done.
Thank you. So when lockdown came in, I mean, we had this weird period, didn't we, in the UK where we didn't lock down, but Denmark did beforehand, and it was just before we go back to Denmark for my daughter's birthday every spring in April, and having to cancel that was the first sort of strike of lockdown. But at the time, everyone was like, "Oh, it's a few weeks.
Yeah.
You know, you can come back and we can do it later." It was her 3-year-old birthday, so it's the first time she actually really realised it was a birthday, and obviously it was without family, without presents, because they were all in Denmark. And then from there on, I just had this feeling that this was not good. It wasn't going to be over anytime soon.
You seem to know things rather better than an awful lot of the rest of us. Now you've had. It's not just about missing a family trip or a birthday party. It's a lot more than that. It's about links with your blood relations are across the channel, and although you chose to live here, you're with an Englishman. You want to spend time with them, but you've had some mental health problems that have really got a lot worse as a result of that. And I think it's very brave of you to talk about this. I really appreciate you sharing this.
So I struggled with anorexia in my teens, which was actually triggered by gluten intolerance I developed when we moved to Belgium. Too much wheat. But that I struggled with for many years. Was underweight for many years, which I finally just before, like, during uni days, I started working out, got a personal trainer, lots and lots of effort to get your body used to eating, get your mind. I think the most important thing is the mind, really.
But you'd battled against it for years, got into a really good place, but then lockdown really made that a much harder battle for you to win.
It did, because I got into such a good place I could even go through a pregnancy without any mental problems. But then all of those things, going to the gym, I did dancing several times a week, and all of those things just disappeared. All of the coping mechanisms disappeared, plus with the added stress. I couldn't be furloughed because I work at university, neither could my husband, and having to do online teaching and taking care of all of these students, especially the first years, meant so much more work. So there was less time, it was more stress. Every day was stress. And because we were here without any family, I mean, there wasn't any help at all, really. I didn't have a grandmother that could come by and take the child for a few hours. So I simply just slipped into stopped eating. Some days, it'll be, I've missed our breakfast. And as the weeks went on, is sometimes, now sometimes I don't get anything before dinner,
Yeah.
because it's just this, and a few weeks ago, my husband had to say to me, like, you've only had dinner, and quite frankly, you've had a toddler portion, and you're not eating anymore.
That's when
But
you realised that it was the eating disorder was back with a
yeah,
vengeance. But you also, in your message to us, you also said also, and I think this is something I know a lot of people are struggling with, and we're going to reap the fallout of this for many decades. Drinking got out of control
yes,
as well as just a coping mechanism.
yes, not something I'm proud of at all.
No.
But I used to, before all of this, I used to open up a bottle of red wine on a Saturday, have 2 glasses Saturday, Sunday, and that was about it. Then lockdown came, and I started drinking on a Friday. That's also sort of weekend, so that's fine. Then you start going, well, Thursday is a little evening before weekend,
Yeah.
so I can drink on a Thursday. And then it started being, Monday is a bad day. It's always bad to go for a Monday.
I think a lot of people are hearing this and saying, yeah, we certainly in my family,
Yeah,
we routinely wouldn't, 2 or 3 days a week certainly wouldn't have a drink, maybe a couple of glasses. Everyone I know is drinking a lot more than they used to, just
yeah,
because, what else to do, and just, let's get through another Monday, get through another Tuesday. And it's not healthy. It's not good for us.
no.
We're going to have a penalty, especially if you're not even eating properly. It's
Well,
doing
that's
even
the
more
other thing,
damage.
isn't it?
Um,
Yeah, that's the other thing.
What I mean, a lot of people might listen to this and say, "Oh, come on,
Yeah,
Amanda, you still got a job, you got a family, get over yourself, just have another meal, love." I mean, a lot of people can be very glib about this, but this is a serious mental health issue for you and your family. This is a serious health issue. A lot of the things that help you as your coping mechanism are not luxuries; they are the framework of how you cope mentally. Um, if government ministers are listening, and I know they do to this show, what would you want them to hear? What do you want to say to them?
well, it would be absolutely amazing if when we hear time and time again that all we care about is people's health, that they're healthy, and it is very sad to see that, losing weight is not the only problem, isn't it? Lots of people are now putting on weight. Um, the mental deterioration, and I just wish that they actually took public health as the health of the public, and not just being focused on COVID,
Yeah.
because in the end of the day, it's going to make, if public health gets worse, COVID's going to get worse as well. And it seems just a bit counterproductive to be so focused for
I
a whole
couldn't
year.
agree with you more. Amanda Bailey-Hass, thank you very much for being so brave talking about that. I know that takes a lot of courage to do that, and I think you've done a real service to people to talk openly about it. People shouldn't be ashamed about mental health problems. I know so many people who are really struggling right now. I really appreciate you joining us and telling us your lockdown story.